Hey, you guys. So I am back. I just wanted to go over a few things. As far as third semester is going, it's going really good. I am very excited. I'm kind of just chilling because I have to go to work in like an hour. So let me just tell you how it's been going. And so we started off school pretty strong. We had an exam a week later. And so far, we've had three exams. We've had IV checkoffs, venipuncture. This was the last part of checkoffs, so thank you, Jesus. But I passed on my first try, you guys. I did venipuncture first. The way they set things up, you pretty much have a patient, you go in, there's orders for blood draws, depending on what the patient has. You grab the correct vials, you go in, you do the blood draw, then you come in, and if the patient's ordered lactated ringers or normal saline. You grab your drip, your bag, I want to say your primary bag, and you prime your tubing. You get everything prepared and ready to go in and insert your IV. We did that, and I passed, you guys. It was amazing. So far, so good. Let me just tell you how stressful this has been, and it's only been, I want to say, a month now. And so we've had three exams. It's been pretty crazy. I passed all my exams, y'all, nothing but the grace of God. Because when it comes to the LVN program, it goes so fast and you're learning so much. It's like you have to learn what the RN is supposed to do along with what you are supposed to do so you don't do the RN's job. But at the same time, you know what not to do. And so a lot of med surg has to do with the body systems, and what we're dealing with right now is endocrine system, going over those hormones and if they're out of whack. A lot of you've heard the Addison's, the Cushing's disease. You also got the diabetics. You have a lot going on in endocrine. So that's where we are right now. That's going to be our fourth exam. And so I've been passing. I've been doing very well, y'all, considering the fact that I work almost 30 to 35 hours a week. And so the prioritization is real. I want to say the last two semesters I did not work. So I just want to make sure y'all know that I just started this job, and I work at night. So I go to school during the day, go to work at night. I probably have sometimes between, I have 2 days off a week. They may call me in, and I go in faithfully because mommy needs coins, and we all know how that goes. I have a family, and I have a daughter, and he has a daughter, and the things that we have to do for our family, y'all. Because we're in nursing school, it doesn't stop. And so finances are still there. I have to pay my cell phone bill. I have to put gas in my car. At first, it was, easy to get through and get by with our family. But, we're going through so much. And I'm just so grateful that I that I only have 3 months left. My birthday is in October. So I don't know what I'm going to do. Honestly, we're thinking about taking a little vacay next week. And so, yay for that. But as of right now, y'all, what I want to talk about, because enough about me, but what I want to talk about as far as like when you're at the very end and, you push through and you're doing your very best and, there's life circumstances, whatever. But you always want to recall why you started this, torturous schooling in the first place. And my first agenda was always to the children. And and I always wanted to be that nurse that always dealt with the children or the elderly, people that are, innocent in the main cause. A lot of people, I don't want to say innocent. There's a lot of things that happen along the way, especially doing my clinicals in the hospital. But what I wanted to suggest to those that are in school around the end there, you're going around that last lap and you're in your last semester, is really consider what kind of practice you want to do. And depending on what kind of nurse you're going to be, LPN or RN or whatever it is that you're going through. For the first time being in school, you may already have, your LVN and want to be a BSN, but you already know who you are. This is a little different. We're in a professionals development class where we are having to study and put a lot of information in as far as what LVNs can do. And it's not to say that a lot of people, I have to do medications. And the reason why this is very important for me in my study and my presentation for the class is I want to practice everything that I've learned. If I've practiced IB and had to check off for IB, I want to be able to do those things. And so whenever you're job hunting or doing your resume or considering where you want to be in life as an LVN or RN or whoever it is that you're practicing to be, whoever you're called to be, I'm sorry for the background. I'm outside. It's the better lighting. But whoever it is that you're trying to be or God has called you to be, make sure that you understand the facility's policies in regards to what you can do. And as I was studying for professional development and I'm in the presentation of medications, IVs, piggybacks, any of those things, it is not mandatory for that LVN or LPN program to teach you IV therapy, or mine does. It has accredited where it does license us in accreditation for LVN therapy, IV therapy, things such as that. There's things we don't do, like, blood infusions, things like that. Specialty medications, we don't do those. But I begin to look up facilities that allows LVNs to do certain things. And there was one particular place where I started that pushed me into becoming a nurse and a for sure job. After I graduate, I want to make sure that I can practice what I know, because if I'm going to be there long term, or, as far as getting the necessary training, as far as when I go to my BSN and master's, I want to be able to say that, hey, I know how to do these things going into those other programs and what it is that I'm supposed to be learning. I don't want to be set back even though I'm capable of doing more. And so I'm making this video not only just to kind of share to you what my journey is, but as far as thinking wise for yourself. If you are in a field that you want to do the elderly, you want to be in the nursing home, you want to do home care nursing, and that's what you want to do as far as your basic or whatever it is, your basic line, your this is who I am, that's great. But know the facility, know the policies of where you're wanting to go, because you want to get the most experience out of that, and you want to be able to use it in your future life. If you want to travel, you have to have certain types of training, you have to have experience, you have to have these things in order to push forward to whatever your end goal is. And so with me, my end goal is traveling. I don't know if I want to do ICU. I don't know if I want to do, trauma. I don't know if I want to do med-surg floor, telemetry. I'm not sure. And I first decided pediatrics. And the place where I wanted to go does only hire LVNs. So yay for that. But is it going to give me that experience I need as far as my master's degree? Is it going to push me towards my end goal and who I know as a person, who I know for myself and what I want to do as an end goal, which is travel nursing and being able to help abroad? Because that's what I want for myself, and that's what our family plans to do, is travel abroad and be able to use our certificates and our licenses wherever we go. And so I just wanted to kind of put that little bug in your ear in regards to your end goal. We're rounding, I'm just step one, it feels like, getting this LVN license. But I always am prioritizing and making sure, I have plans and goals, and that does not intrude with the rest of my life. And so if I can get these steps already in order, then I can explain this to my family and explain this to the ones that are, on Team Whitney's side. Because I'm telling you what, guys, if it wasn't for the team, I would not be have made it this far. Let's be honest. And so we work together and not apart. Everybody knows the end goal. Everybody knows the plan, and that's what's most important. So let me know if you need to hear anything else about med surge right now. It is going like hectic. Babe has been praying over me, and I've cried many days already. But you guys just pray for me. I thank you so much. Please subscribe and like if you have not. And if you want to hear anything else, just hit a comment. Let me know, message me, whatever it is that you have to do to get through this. You can make it, sis. You can make it. All right.